Good morning, good afternoon, good evening, colleagues, to everybody who has joined us online as well as here in New York. A very warm welcome to briefing on the UNICEF 2017 annual results reports. We are very excited. This is the first time that we will be doing this virtually. So it's a pilot test. So thank you very much for joining us in this new approach. And hopefully it will be a success. So just while other colleagues are coming in here in New York, I'll probably say a couple of things and then we will do a quick round of introduction. So as you're aware, for partners online as well as here in New York, we do this annually. The thematic funding is a very, very key source of funding for UNICEF, which complements the regular resources which equip us to deliver the results of the strategic plan. I hear a bit of an echo. I'm looking at Jonas too. So for those online, if you could kindly mute your microphones, that would be very helpful. Okay, so maybe I can resume because the echo has gone. So I was just conveying a very warm welcome, and as I was saying that this is an annual session that we do around the annual session of our executive board. This is the first time we are doing it virtually, and on behalf of UNICEF, I'm very pleased to thank all the partners who have joined us in this dialogue and who, of course, contribute to the multi-year flexible funding. As I was mentioning that at the global level, as it is called the global thematic funds, these are an extremely important and strategic complement to the regular resources that allow UNICEF to deliver the results of the strategic plan, results for children and communities. I will first let me introduce myself. Having said that, I'm Mandeep O'Brien. I'm the Deputy Director of the Public Partnerships Division here with UNICEF in New York. And just while we are having others coming in New York, just to say that the objectives of this dialogue, which will run through the next 3 days, today, tomorrow, and the day after, we will be walking through 8 sessions on the 8 thematic funding pools for our strategic plan period of 2014-2017, with a specific focus on the results that have been achieved last year in 2017. So the purpose of the dialogue will be threefold. A, to take stock of the results achieved in 2017. B is to see how we have impacted, how these results have impacted the lives of children, vulnerable women, and communities. And C is, in doing so, we're also looking at the lessons learned for the new strategic plan. And as you know, that this is the first year of the implementation of the new strategic plan. That said, just to probably do a quick round of introductions, and I have been given specific instructions by the organizing team here in order to best manage this virtual meeting. So first of all, for colleagues who have joined us by Skype, please do introduce yourself by instant messaging so that we have a real-time list available with us, and we will call out your names and representation. For those who have joined us by telephone, please call out your names now, and then we will introduce colleagues here present in New York. So colleagues on the telephone line. Is there any way of knowing who has joined? Okay. If you have joined us by telephone, please call out. Please unmute your microphone and introduce yourself. Okay, so looks like there's nobody joined via telephone. I'm looking to Cecilia in terms of colleagues who have joined via Skype.
So we have Sabine Rakotomalala, Lena Forsgren has just joined us from CEDA, and Valeria Bonifante. Oh, we're also getting Valeria Bonifante, which I believe must be from Italy, but if you could also give us your affiliation, that would be very helpful. Camilla Redner, also from CETA. Brigitta Vipar. So we have a group who's sitting all together. There we go. And Katarina Fabianson, all from CETA.
Okay. Thank you very much, colleagues from CEDA, for joining us. We have quite a number of other confirmations, so assuming that colleagues will join us as we proceed with the session. For colleagues online, please, let me start with you.
Hello, my name is Lise Casoli, and I'm with the Belgian mission.
Thank you, Lise.
Cornelius Williams, Chief of Child Protection, UNICEF.
Thank you, Cornelius.
Hi, I'm Norma Louise Harhoff from DR.
I'm Catherine Bolden with the Child Protection and Emergencies team.
Sumaira Chaudhry with the Child Protection Planning team.
Alex Ford from the Child Protection Planning team.
Sergey Flynn from the Child Protection Planning team.
Eridu Reddy from the Child Protection Planning team.
Cecilia Fantoni, Public Partnerships Division.
Poonam Vijay, Public Partnerships Division.
Fernando Gutierrez, AU Public Partnerships.
Yalini Balarajan, Nutrition.
Jonas Panchon, Public Partnerships Division.
Okay, thank you very much, colleagues. As you would have picked up from the New York introductions, Lise, thank you very much for joining us, and the rest of us are from UNICEF here, as you heard through the introductions. So maybe without further ado, I'll probably start with the first segment, which is on child protection. Just to say that over the next 3 hours, with a couple of breaks in between, we will be taking you through the sessions on the global thematic funding pools on child protection, followed by humanitarian action and then education for today. And over the next 2 days, we will cover the remaining 5 global thematic funding pools. In terms of the format of the session, we will start with a quick presentation today in the social protection by Cornelius and his team, which will be around 10 minutes, and then we will follow that with whatever time is left for the question and answer and hopefully an interactive discussion. So Cornelius, over to you.
Thank you, Mandeep. So good morning, good afternoon, good evening, colleagues and participants. We're pleased to have finalized the UNICEF Child Protection 2017 Annual Result Report, and in the next 15 minutes I'll just provide you with an overview of the key results and also our plans for the next 4 years before the discussion. Can we move?
Cornelius, just as you're proceeding, just to remind our colleagues who have joined online that if you have specific questions as the presentation is proceeding, please feel free to write them up on the instant messaging. We have our team here that is collating real-time all the questions, issues, and points for clarification so that we can optimally use the time that we have in the Q&A. Back to you. Sorry about this, Cornelius.
Okay, so 2017 really has been a checkered story to tell, with exposure to violence, exploitation, abuse, and neglect remaining a stark reality for millions of children. And as you can see by the slide, over the past 10 years, actually, the number of political conflicts has risen, and we still have a lot of children affected by conflict. But let me start with, we have 300 million children, 2 to 4, who are still subjected regularly to violent disciplines in the home. We have 200 million girls and women alive today in 30 countries have undergone FGMC, female genital mutilation. We have 15 million adolescent girls who have experienced forced sex in their lifetime, 15 to 19 years old. 5% of children aged 5 to 17 are working on the worst forms of child labor still. 1 in 4 children affected by humanitarian crisis, living in countries affected by humanitarian crisis, and 2.7 million children actually are living in residential care. The issue of the children living in residential care, we feel it's a tip of the iceberg. It's really not a true reflection. We feel the number is larger, but we're still challenged with definitional issues, which we are working with partners to try to address. If I may remind you, actually, every 7 minutes, an adolescent is killed by an act of violence. Almost 1 in 5 homicide victims worldwide was a child, 70% of whom were adolescent boys. So the situation is still grim. And the issue is, we've shown all those children who are affected, especially those who are affected by violence, but they still do not receive services or go for the services that is available. And the quality of service, even if it's available, it's not optimal. Excellent. But there's some good news, right? We're looking at 2 impact indicators, 2 key indicators. The percentage of women 20 to 24 who were married or in union by age 18, and the percentage of children under 5 whose birth were registered. Both have shown positive trend in this last SP strategic plan, the period of the strategic plan. As you can see from the slide, it is possible to provide birth registration services for children, and it's possible for parents to bring their children forward for birth registration. So you can see we've moved from 65% to 75%. It is possible to stop child marriage, and we can see that actually families are buying into it. You can see the 25 million children who have been prevented from getting married in the last decade. And in South Asia, it's really a success story from 49 to 30%. There are other success stories in like 3 countries. We saw a decline of at least 30% in the proportion of children 2 to 14 who experienced violent discipline by parent or caregivers. We saw in 3 countries 10% or more in the proportion of girls aged 0 to 14 years undergoing female genital mutilation. We also saw in another 3 countries less than 10% of children aged 5 to 17 who are involved in child labor. And we're seeing in 24 countries a 10% reduction in the proportion of children in residential care. In the humanitarian situation, we've noted that 22% of the parties to conflict who are listed in the Secretary General's report in 2017, of these 65 parties who are listed, 22% has a national action plan. Can we move on? So we believe actually for 2014 and 2017 there was a success story, but let's look at what we were able to achieve actually, again continuing. Over 25 million children involved in child labor were reached by our services, one UNICEF-supported intervention. Over 52 million children had their birth registered during the 2014-2017 period. Over 25 million people were reached in 9,000 communities, and they declared publicly to abandon FGM. 15 million children received weapons-related education. These are mostly in countries that have gone through conflict and had UXOs and mines actually still left over. 11.6 million children were reached through community-based messaging on child marriage. And one of the issues in emergency is the gender-based violence in emergency, and we feel this is a major success. We were able to scale our reach from 400 girls, boys, and women in 2014 to about 3.6 million in 2017, because we now know how to scale up and put in place systems across the sectors to reach these children and women, boys, and girls. In 2017 as well, we had 141 unaccompanied and separated children in humanitarian situation in 40 countries. Half of these children actually, again, we will show the number of children that were reunified. But the highest numbers were reported in Kenya, Libya, South Sudan, and Uganda. Only 40% were reunited with their families in alternative or placed in alternative care, and this was due to the security issues and humanitarian access. Can we move on? So for 2017, what were the results? 16 million births registered across 58 countries. 36 unaccompanied children. Again, we can see that mostly it's about half of them that were reunited with their families and caregivers. We're having a challenge there, and it's due to the humanitarian access and security, and also actually getting the services to respond in a timely fashion. 12,000 children were released from armed groups and they were reintegrated with their families and communities. 3.6 children and women benefited from the gender-based violence risk mitigation or support service, which I spoke about. This, I can say, we now know how to integrate it into the other sectors. It's not only a child protection intervention. 3.5 million children in humanitarian situations receive psychosocial support, and 8,700 girls and women at risk of or affected by FGMC, female genital mutilation, received related services. 1.1 million girls at risk of child marriage were reached with life skills support. So these were the results for 2017. It's a highlight of the results. It's not the only results, but it's important for us to show our reach and what we were able to achieve. Can we move on to the next slide? Here we just want to highlight a couple of countries, 5 countries where we feel that the thematic funds made a difference. In Bolivia, we supported government capacity to build the child protection services, and these include 12 specialized centers for children and women who suffered from sexual violence. So over 500 children received psychosocial assistance. 397 children were supported with child-friendly legal procedures, and over 700 children were provided with alternative measures for children in conflict with the law. That means that these children who would have been deprived of their liberty were provided with alternatives like community services, etc. And we continue to try to build the intersectoral coordination between the health sector and the civil registration in this country so that newly born could be timely registered at birth. In Bulgaria, we continue to provide technical assistance for the development and adoption of a national program for the prevention of violence and abuse of children. And we've developed a pilot program, and if this pilot program actually proves successful, the government is going to scale it up. It's in 3 regions now, and we believe it will cover 28 regions. The government will provide the resources. We believe they have the fiscal space to do it. All the government wanted was for us to work with them to show them technically what can be done and how it can be scaled up and the cost of it. Already, actually, the government is able to support early monitoring of 200 child victims and their parents in these 3 regions that have been supported. In Indonesia, funds were provided to model child marriage. Suddenly, Indonesia has become important in terms of child marriage, and there's a discussion going on if Indonesia should join the joint program, the global joint program on child marriage. Whilst they're waiting on that discussion, the office is not sitting still. It's using its thematic funds to engage religious leaders and adolescents. And also, actually, they're working around public financial management. And this is one of the countries where we've been able to do financial benchmarking of what is child protection. If you cannot do the financial benchmarking, you cannot be able to analyze the budgets in these countries and be able to advise the government on how to increase the budget and utilize their resources in a more efficient manner. They're preparing for the VAC surveys, and you're aware that we have VAC surveys are carried out in many countries. Funding for this VAC survey, some of it is going to definitely come from the government. And then we're working on helping the government to build a capacity institutionally for an integrated child welfare service. There are several pilots. Again, the same thing like in Bulgaria. If these pilots are successful, the government is going to scale it up using its own resources. One of the changes we want to emphasize is the change in the landscape, where we're supporting projects, we're now supporting pilots, and when these pilots are proved to be successful, these governments that have the fiscal space and the wherewithal are scaling it up nationally. And so we believe this is a pathway to scaling up child protection programs nationally. And so let me go to South Africa before I come back to Mali. because this shows how the government is scaling up its program. So with the thematic funds, the government supported the integrated program of action on violence against women and children, and they were able to link it to one of the famous child protection programs globally, Izibindi, that has a child and youth care program. This resulted in capacity building and training of 6,700 child and youth care workers. In addition, they were able to establish 400 safe pack and drop-in centers, creating 60 specialized courts and 66 one-stop care centers for sexual victims. Imagine the reach, 60 specialized courts, okay? These courts are being covered, the resources to run these courts and the resources to run the drop-in center, which is a multi-sectorial center with health, law enforcement, social welfare working together. The resources is provided by the government. This is what we're talking about scaling up. With us showing doing the pilot, with us UNICEF providing the technical assistance, and the government scaling up the services and maintaining the sustainability of the services. In Mali, which is a fragile state, we contributed directly to the National Child Protection Draft Law, supporting the government technically, a communication strategy on GBV, child marriage, and FGMC, and we are also supporting the development, the capacity building of the civil registration. If you don't have an identity in Mali, if you don't have a birth registration, you will undermine your care and protection, especially for a country that is going through a crisis, security crisis, and a militant insurgency crisis. The issue of identity management is very important. We were also able to support 3,505 gender-based violence survivors, and we were also able to support transitional care for children and reintegration for children that were released from the armed forces. Next slide. So what are the lessons that we learned? I've started talking about some of the lessons that we learned, but one of the lessons that we learned is that child protection programming is cross-cutting. It needs to be embedded in the different sectors, the health sector, the education sector, the social protection sector, the water and sanitation sector. It needs to be embedded across the sector. In addition to that, actually, the social service workforce, I spoke about Isibindi. It's now very clear to us that, especially in countries that are going to scale, that they have to ensure that they have a social service workforce in development and humanitarian setting. This is where we have the development and humanitarian nexus, as we have shown actually with our work in Lebanon, where we supported the government social services as well. And if the workforce is not able to deliver quality services, they will not be able to do the case management. And this is one of the things we're talking about. And children and families will not use the services if the workforce is not of quality. Technological solution. We don't feel that you should graft on your technological solution after you finish your program planning. As they now say in the business world, all business is a digital business. We also believe all programming is a digital program. You need to factor your program, your digital solutions into your program planning and not at the end. And I'll talk about it when we move into the next, some of the next slides. Adaptive CPIA programming. The landscape has changed. Politically and security-wise, the landscape has changed completely. We now have militant group who it's difficult to negotiate with them. New restrictions by member states in working with these groups. So the landscape has changed. Millions of people, children, moving across borders, unaccompanied with their families, frequent national disasters. So we feel that we need an adaptive child protection and emergency programming. And with the UN reform, we feel that the joint governance structure, we have seen that in the two joint programs. We usually would say that the global joint program for child marriage and acceleration of ending child marriage and FGMC, these are the two largest joint programs, shows that how the UN can work as one. So a joint governance structure, we believe it's a program accelerator. And talking about program accelerator, we are framing the 2018-2014 strategic plan within the 2030 agenda, and it's a framework for action. SDG 5, 8, and 16, UNICEF has been identified as the sole or joint custodian for the 8 child protection indicators. And we're also contributing to 1, 3, and 4. I'll talk about that later. And this is the strategic plan, goal area 3 of the 2018-2021 strategic plan, which will ensure that every child is protected from violence, exploitation, and abuse. We will advocate to scale up the 3 program areas. 1, preventing and responding to violence against children. Output 2, accelerating the reduction of harmful practice, FGM and child marriage. And output 3, enhancing child access to justice. And when we are talking about access to justice and children in conflict with the law, we are talking about victims, witness, alleged offenders, and children who are parties to administrative proceedings that affect them. As governance structure mature in most of the middle-income countries, we are having children who would need support in the administrative justice system. So this is it, and we're not looking at whether it's humanitarian or development. We believe the 3 results can be implemented within a humanitarian and development nexus. So what would we like to emphasize and scale up and invest in? First of all, we have to invest in the child protection system. We believe actually the social service workforce should be strengthened. If you strengthen the social service workforce, then you have to do the regulations. If you don't do the regulations, how will you regulate the social service workforce? In fact, what curriculum will you use to train this workforce? If you want to regulate the social service workforce, you have to do the legal reform. If you want to have a social service workforce, you have to work out the budgeting and the fiscal space to cover this workforce. If you want to have quality workforce, you have to have accreditation. And you have to ensure that this quality workforce actually is a workforce that can work with children and can work with children who have been abused so that these children do not have secondary traumatic experience. And we do not fail these children by providing them with substandard quality of service. We also have to do the bridging of the development and humanitarian program, which I spoke about. And we have seen that we can do that, especially in countries where, despite the fragility in these countries, there's still a governance structure that we can work with. We have to address social norms. We're working to address social norms. We have a framework that we're testing in Ethiopia and Guinea of how we can be able to implement social norms and measure social norms. We have to invest in data, research, and monitoring. We have already spoken about how we will invest in data, research, and monitoring, and we believe actually that we have to build a data ecosystem and infrastructure to have comparable data and hold countries accountable for achieving the SDGs. I spoke about the indicators in the SDGs. And the reason for this, I want to stress the importance of comparable data. Because we're not talking about a one-off survey, we're not talking about just some research or some RTC. We want to have year by year or periodic periods, just as our health and our education colleagues have, of comparable data, so we can hold government accountable and see where government is going. In addition to that, in building this ecosystem, the SDG and the principle means that government should own their data. And so we are going to invest and build the capacity of government to do that. Now, we're going to make sure, as I said before, increase the survivors of sexual violence who seek help, and from 4 to 10%, reach over 2 million girls at risk of child marriage and over 1 million girls and women with FGMC service, increase the countries with quality social services, And in our emergency response, we need to make sure that we're reaching 80% of the children who are targeted. This is the funds. First of all, we should say thanks to and show a deep appreciation to all those who have contributed to the work on child protection. And we would like to particularly say thanks to the governments of Sweden, Denmark, Norway, Spain, Belgium, Canada, Hungary for the thematic funds that has allowed us flexibility. And I've shown some of what we've been able to achieve with these thematic funds. There are critical funding gap. These days, everybody talks about the prevention of sexual exploitation and abuse. In the programming, there is limited resources to take this to scale. We have a partnership with IOM. Our executive director is going to become the champion for ISCP prevention of sexual exploitation and abuse. We have an ambitious agenda of ensuring actually that in the 29 humanitarian situation, the population is able to have access to good reporting system of sexual exploitation and abuse, but the funding is limited. Protection of children online. This is the new threat to children, but again, the funding is limited. Violence against children. Though we have made this a global policy agenda, we still feel that we do not have enough funds to roll out the programs. And on alternative care, it's limited funding, and unaccompanied and separated children needs more resources. Finally, in summary, we're proud of what we've been able to achieve in the strategic plan, in the last strategic plan. We're conscious of the scale of the challenges ahead, but I can say that actually we're confident that we now have the evidence, we now have the experience to deliver the results for children, and we see this year as a real jump-off point for accelerated progress, and we look forward to a continued collaboration with you. Thank you very much.